Non-implant tooth replacement options. I think we have done a lot of videos on dental implants. What are the benefits of dental implants? But sometimes patients can't get dental implants. It can be because of their health conditions, it can be because of their bone conditions, it can be because of their economic conditions. But in those instances, what are some of the other options that are available? So broadly, I would classify this as three things. One is removable options, fixed options, and there's an intermediate one or a semi-fixed options. So when it comes to removable options, those typical options are removable dentures, where these removable dentures are typically made of a resin material, which is called acrylic. Those resin material provides support to hold the teeth and helps the patient to chew well on the teeth and eat well. So these are removable options. When it comes to these resin material are not strong. They can lead to other problems to the adjacent teeth or can cause ulceration in the gums. So one of the better means of giving a removable denture is called a cast partial denture. What do we mean by a cast partial denture? Is instead of a resin base, we get a metal base to the patient. The advantage of giving a metal base in a denture is, one, the metal base can be really thin. And because it is thin, it doesn't cause a lot of discomfort to the patient's mouth. And because it is thin, it behaves more as close to the gums as possible. For example, when you take something like a hot food or a cold food, it is just not the food is hot or cold, the way our gums perceives the heat or the cold is one that gives us the satisfaction of having something hot or cold. When you have a metal denture base, it will also become hot or cold, something similar to our gums. So it gives us, there is a lot more joy in having the food, a lot more satisfaction in having the food when you have the metal denture base. So that's the second benefit of having a cast partial denture. The third benefit is the cast partial denture can be far more retentive and stable in the patient's mouth by the virtue of the mechanism by which we make it. So now because of this, the denture doesn't easily come out loose and they can last for many years. So these are the removable options what I spoke, which are non-implant options. The better one is to get a cast partial denture made than a regular acrylic dentures. The second option what I told are fixed teeth or fixed partial denture. These are typically the crown and bridge is what we call it, where we take support of the adjacent teeth, and because by taking the support of the adjacent teeth, we are able to bridge the gap that is there. The only minus of this is if there are not enough adjacent teeth or the gap is too long to bridge, we won't be able to give a fixed partial denture. We need to only resort to a removable denture. So that's the second option of a non-implant tooth replacement. But fixed partial denture again is safe. It's been done for many years now, and the tooth can last for a very long time. So it's very important to understand what the patient requires, what is the tooth condition, and what is the best form of tooth replacement. It's not that implant is the best form of tooth replacement. Sometimes fixed partial denture can be better than dental implants in certain instances. So we need to diagnose, understand the patient requirement, and then give what is the best suitable to the patient. The third option what I said is semi-fixed. When I say semi-fixed, it's between fully fixed option and a removable option. Here typically these are called precision attachments. We have some crowns that are made on our existing natural teeth. These crowns have got an extension or attachment apparatus. Onto the attachment apparatus, the removable portion goes and locks into it. So typically it's like a lock and key mechanism. When the patient wants, can exert a little force on that and then take it out. And when the patient wants to wear the denture, they can just click into place and you go and sit into it. It's a typical lock and key mechanism. These are something called precision attachments or semi-fixed options. So these also have got a certain benefits that are there because it helps to replace as many teeth as possible, giving the comforts of fixed teeth, but at the same time having the benefits of removable teeth also. These are semi-fixed teeth. So these are some of the options that are available which are non-implant options for tooth replacement. If you have any questions, please do ask in the comment section below. We'll be happy to answer. I hope you liked this video. Please do like and share this video, and of course do subscribe to the channel. This is Dr. Arun from Pearls Dynasty. Until next time, bye bye and thank you.
கிளிக் பண்ணுங்க, சப்ஸ்கிரைப் பண்ணுங்க, பெல் ஐகான் கிளிக் பண்ணுங்க. இந்த மாதிரி வீடியோஸ் உங்களுக்கு வரும். தேங்க்யூ.